An alternative to UTIs, my project is about phage therapy by Chloe Jeter. So, introduction. Urinary tract so this project will be about urinary tract infections, about how they're common infections. They're often caused by E. coli, mild to severe complications. Main treatment is antibiotics. Antibiotic resistance is a major resistance. So what are UTIs? UTIs are infection in the urinary bladder, the bladder, urethra, and the kidneys. The bacteria enters these areas and it multiplies. It's most common in women, and it can be recurrent and difficult to treat. Here's a picture. So a problem is antibiotic resistance. So there can be an overuse and misuse of antibiotics, which is resistant bacteria. The infections become harder to treat. It may require hospitalization or stronger drugs, and it creates urgent need for alternative treatments. What is phage therapy? Phage therapy uses bacteriophages, which are viruses that infect bacteria. It targets and kills specific bacteria. It does not harm human cells, and it is considered a potential alternative to antibiotics. How do phages work? They attach to the bacterial cell and inject genetic material. Then they replicate inside the bacteria, and that causes the cell to burst, which is the Lytic cycle, and then that releases new phages to attack more bacteria. Advantages of phage therapy. It's highly specific, which targets only harmful bacteria. It preserves beneficial microbia. It can evolve with the bacteria. It has fewer side effects with antibiotics, and there are multiple ways to administer it: orally, IV, or direct. Here's some phage therapy. Research and effectiveness. Studies show reduction in bacterial counts, effective against antibiotic resistance, UTIs. Case studies show improvements in patients. Some infections completely eliminated, and there's a more large-scale trials that are needed. Limitations to phage therapy. It must match correct phage to bacteria. It's time-consuming identification process. There's no standardized treatment protocols. It's limited regulatory approval, and there's storage and production challenges. Ethical and legal issues. There's a lack of clear regulatory guidelines. Its personalized treatments complicate approval. There's need for informed patient consent, limited access in some areas, and ongoing ethical concerns. Future potential. Genetic engineering of phage. There are phage cocktails for broader treatment. Combination with antibiotics. It could reduce antibiotic resistance globally, and it may improve healthcare outcomes. In conclusion, phage therapy is a promising alternative. Targets bacteria specifically and effectively. It helps antibiotic resistance. Challenges do remain, but research on it is growing, and it could play a major role in future medicine. Thank you.